My name is Russell Ramey, and I'm the Surgical Director for Cancer Services at Mercy Medical Center. I think for me, the purpose of having a laser-focused team that is always mandated with increasing our quality of care is a very optimistic thing. What drives me, what brings me to work every day is just knowing that we're always going to do better. I love the fact that we hold ourselves to standards, we measure those metrics, we follow those standards, and when we meet them, then we increase the standards. I think that it benefits patient care directly, and it's a blessing on my part to be able to be involved with a quality team of people that is so driven and so laser focused on patient care and excellent outcomes. The fact that we're always measuring ourselves against national benchmarks and following and tracking our data and reviewing it just means that the patients always can be comfortable that our quality is ever improving. They don't have to wonder, is care going to be better at a nationally recognized center that is in New York City when they have that same data, the same metrics, the same quality parameters that we're following here. I think it brings comfort to primary care physicians knowing that they can confidently refer their patients to the care of physicians that are at Mercy Medical Center, that they know that we're on top of the quality metrics and that we're doing our very best with patient care. There are many things that make the breast center at Mercy Medical Center special. I think people are the number one thing that makes us set apart from other places. There are excellent people within the entire process of the breast cancer care center. I have great confidence in telling patients that there's literally not a problem that they could have, a need that they could perceive, that we don't have somebody excellent that can address that. I think the process is also important. I think that the fact that we hold ourselves to high standards is ultimately what drives everything. Nurse navigators are key to every process. They are the hand holders. They walk patients through the entire process. Sometimes access to a big hospital system can be cumbersome, can be confusing to patients and referring physicians. Our nurse navigators are those experts that come alongside the patient and make the system navigable for them. They straighten out the normal crooks in the road and they make their path straight to be able to get not only the best care but the most timely care. We have bi-weekly multidisciplinary care conferences with literally every specialist that pertains to a given cancer site around the table. For patients, it's like getting free second and third and fourth opinions. We present all the information of the cases without names so that we can all review and to make decisions together. If there's any trials that would be appropriate for somebody's individual situation, that's also brought up. If there are additional testing that anybody would recommend, that's also brought up. So for us, it is a part of how iron sharpens iron. I think life is busy. I think primary care docs are inundated with so many things that they're trying to accomplish for their patients. The fact that we have a one-call access system, I think, is value added for them. Rather than trying to navigate through the processes in the system by themselves, which takes their time or their office staff's time, all they have to do is call, one number, and the experts at Mercy Medical Center can take it from there. 4 awards for you is not just a slogan, it is a commitment to quality. I think for patients that it gives them or can give them the confidence that they know that it's not just a name, it's something that we strive for every day. It's something that is evident in our processes, in our personnel, and the care that we deliver, and ultimately their end goal of being cured of their cancer. Part of the quality that is evident in our program for the care specifically of colon cancer is the advent of robotic surgery. We were early at Mercy Medical Center in adopting robotic surgery, and our outcomes are excellent. The changes that I've seen in just my tenure of being able to do robotic surgery are just numerous. The benefit to patient is amazing. surgeries that used to have a patient in the hospital for 7 to 8 days now has a patient in the hospital for 1 day or 2 days at the most. That is not something that is just driven to get patients out of the hospital for quicker care, but actually our metrics show that our care is better. They have fewer complications, there are fewer risks to those surgeries, and their recovery is not just faster, but it's better, which is pretty amazing. I think the best read that I have on the quality of care in the Mercy process is just from patients' feedback. Patients refer back to all of the different steps in their process because they remember those and they matter to them. And that's the most accurate and most motivating feedback that I get that suggests that we are doing everything that we need to do in order to have excellence in patient care. I think that being recognized these 4 times with the Outstanding Achievement Award is an amazing accomplishment, but in the end, I think that it speaks most to patients. 4 awards for you means that they can have the confidence to know that their care is second to none.